Growing older is a gift, but it also comes with the responsibility of paying closer attention to our health. Cancer is a word no one wants to hear, but early detection can make all the difference. For seniors, recognizing the early signs of cancer can be life-saving. Today, we're sharing 8 early warning signs of cancer that you should never ignore. Let's dive in. As we age, our bodies go through countless changes. Some of these changes are just a natural part of growing older, but others can be red flags for something more serious. Cancer is one of those things that can creep up quietly, often without obvious symptoms in the early stages. But here's the thing, catching it early can dramatically improve the chances of successful treatment and recovery. That's why it's so important to stay vigilant and know what to look for. So, let's break it down and talk about the 8 early warning signs of cancer that seniors should never ignore. First up, unexplained weight loss. Now, losing a few pounds here and there might not seem like a big deal, especially if you've been trying to eat healthier or be more active. But if you're dropping weight without trying, say, 10 pounds or more without any changes to your diet or exercise routine, that's something to pay attention to. Unexplained weight loss can be a sign of several types of cancer, including pancreatic, stomach, lung, or esophageal cancer. Your body might be using up more energy to fight off something, or the cancer could be affecting how your body processes nutrients. Either way, it's worth bringing up with your doctor. Next, let's talk about fatigue. We all get tired, especially as we get older. But if you're feeling exhausted all the time, no matter how much rest you get, that's not normal. Persistent fatigue can be a sign that something's off. Cancer-related fatigue is different from just feeling sleepy. It's a deep, unshakable tiredness that doesn't go away. This could be linked to cancers like leukemia, colon cancer, or stomach cancer, where the disease might be causing internal bleeding or affecting your body's ability to produce healthy blood cells. If you're feeling wiped out all the time, don't brush it off. Get it checked out. Now, onto pain. As we age, aches and pains become pretty common. But if you're experiencing pain that doesn't have an obvious cause, like an injury or arthritis, and it doesn't go away, that's a red flag. Persistent pain, especially in one area, could be a sign of cancer. For example, ongoing back pain might be linked to ovarian or colon cancer, while a constant headache could be a symptom of a brain tumor. Of course, not all pain means cancer, but if it's unusual or doesn't improve, it's worth investigating. Another warning sign is changes in your skin. We all know to keep an eye out for new moles or changes in existing ones, as these can be signs of skin cancer. But other skin changes can also be important. If you notice yellowing of the skin or eyes, it could be a sign of liver or pancreatic cancer. Darker patches of skin, redness, or itching can also be warning signs. And if you have sores that won't heal, that's another thing to watch out for. Your skin can tell you a lot about what's going on inside your body, so don't ignore it. Let's move on to changes in bowel or bladder habits. This one might feel a little uncomfortable to talk about, but it's so important. If you notice persistent changes in your bathroom habits, like diarrhea, constipation, blood in your stool, or pain when you go, it could be a sign of colorectal cancer. Similarly, if you're having trouble urinating, notice blood in your urine, or feel pain when you go, that could be a sign of bladder or prostate cancer. These changes can be subtle, so it's important to pay attention and not just chalk it up to aging. Another key warning sign is difficulty swallowing. If you're having trouble getting food or liquids down, or if it feels like something's stuck in your throat, that's not something to ignore. This could be a sign of esophageal or throat cancer. It might start off as a minor annoyance, but if it persists, it's definitely worth getting checked out. Difficulty swallowing can also lead to weight loss and malnutrition, so it's important to address it early. Next up, persistent coughing or hoarseness. A cough that just won't go away, especially if it's accompanied by blood or a change in your voice, could be a sign of lung cancer or throat cancer. Now, we all get coughs from time to time, especially during cold and flu season. But if your cough lasts for weeks or gets worse instead of better, it's time to see a doctor. The same goes for hoarseness. If your voice changes and doesn't return to normal, that's something to take seriously. Finally, let's talk about lumps or swelling. Finding a new lump or bump on your body can be scary, but not all lumps are cancerous. That said, it's always better to be safe than sorry. If you notice a lump in your breast, under your arm, in your neck, or anywhere else on your body, get it checked out. Swelling in your legs or other parts of your body can also be a sign of cancer, especially if it doesn't go away. Lymph nodes, which are part of your immune system, can swell when your body is fighting off an infection, but if the swelling persists, it could be a sign of lymphoma or another type of cancer. So there you have it, 8 early warning signs of cancer that seniors should never ignore. Unexplained weight loss, persistent fatigue, unusual pain, changes in your skin, changes in bowel or bladder habits, difficulty swallowing, persistent coughing or hoarseness, and lumps or swelling. These symptoms don't automatically mean you have cancer, but they are signs that something might be wrong. And when it comes to your health, it's always better to be proactive. If you or a loved one are experiencing any of these symptoms, don't wait. Make an appointment with your doctor and get it checked out. Early detection can make all the difference, and your health is worth it. Remember, growing older is a gift, but it's also a responsibility. Take care of yourself, listen to your body, and don't ignore the warning signs. Losing weight without trying might sound like a dream come true for some people, especially if you've been wanting to shed a few pounds. But here's the thing, when the weight starts dropping off without any effort on your part, it's not something to celebrate. In fact, it can be a major red flag that something's not right in your body. If you've lost 10 pounds or more without making any changes to your diet, exercise routine, or lifestyle, it's time to sit up and take notice. This kind of unexplained weight loss can be an early warning sign of several types of cancer, including pancreatic, stomach, or lung cancer. Let's break this down a little more. Your body is like a finely tuned machine, and it usually maintains a pretty steady weight when everything's working as it should. Sure, your weight might fluctuate a little from day to day or week to week, but significant, unexplained weight loss is different. It's not just a few pounds here and there, it's a noticeable drop that happens without any obvious reason. And when that happens, it's often a sign that your body is under stress or fighting off something serious. So why does cancer cause weight loss? Well, there are a few reasons. For one, cancer cells can be incredibly demanding. They grow and multiply rapidly, and that takes a lot of energy. In some cases, the cancer might actually be stealing nutrients from the rest of your body, leaving you with less fuel to maintain your weight. This is especially true with cancers like pancreatic cancer, where the tumor can interfere with your body's ability to digest food and absorb nutrients properly. Another reason is that cancer can mess with your metabolism. Your body might start burning calories faster than usual, even if you're not doing anything differently. This can lead to rapid weight loss, even if you're eating the same amount of food as always. And in some cases, cancer can affect your appetite, making you feel less hungry or causing nausea that makes it hard to eat. All of these factors can add up to significant, unexplained weight loss. Now, let's talk about the types of cancer that are often linked to this symptom. Pancreatic cancer is a big one. This type of cancer is notoriously hard to detect early because it often doesn't cause symptoms until it's more advanced. But unexplained weight loss can be one of the first signs that something's wrong. Stomach cancer is another one to watch out for. If a tumor is growing in your stomach, it can make you feel full faster or cause discomfort that makes you eat less. And then there's lung cancer, which can also lead to weight loss, especially if it's affecting your appetite or causing other symptoms like fatigue or difficulty breathing. But here's the important thing to remember. Unexplained weight loss doesn't automatically mean you have cancer. There are other conditions that can cause this symptom, like hypothyroidism, diabetes, or even chronic stress. The key is to pay attention to your body and take action if something seems off. If you've lost a significant amount of weight without trying, don't just shrug it off as a lucky break. Make an appointment with your doctor and get it checked out. Your doctor will likely ask you a lot of questions about your weight loss, like when it started, how much you've lost, and whether you've noticed any other symptoms. They might also run some tests to rule out other possible causes and see if there's an underlying issue that needs to be addressed. The goal is to figure out what's going on and catch any potential problems early, when they are easier to treat. So if you or someone you love has experienced unexplained weight loss, don't wait. It might be nothing, but it could also be a sign of something more serious. And when it comes to your health, it's always better to be safe than sorry. Early detection can make all the difference, so don't ignore the warning signs. Take care of yourself, listen to your body, and don't hesitate to reach out to your doctor if something doesn't feel right. Your health is worth it. Feeling tired all the time, even after a good night's sleep. Persistent fatigue that doesn't improve with rest could be a sign of leukemia, colon cancer, or other types of cancer. Don't brush it off as just getting older. Let's dive deeper into this because fatigue is one of those symptoms that's easy to overlook or dismiss, especially as we age. We all get tired, right? Life can be exhausting, and it's normal to feel worn out after a long day or a busy week. But there's a big difference between everyday tiredness and the kind of fatigue that could be a warning sign of something more serious. Persistent fatigue is different. It's not just feeling sleepy or needing an extra cup of coffee to get through the day. It's a deep, unshakable exhaustion that doesn't go away, no matter how much you rest. It's the kind of fatigue that makes it hard to get out of bed in the morning, even after a full night's sleep. It's the kind of fatigue that lingers day after day, week after week, and doesn't improve no matter what you do. And that's when it becomes a red flag. So why does cancer cause this kind of fatigue? Well, there are a few reasons. For one, cancer cells are like energy vampires. They grow and multiply rapidly, and that takes a lot of energy. In some cases, the cancer might be using up so much of your body's resources that there's not enough left for you to feel energized. This is especially true with cancers like leukemia, where abnormal blood cells can crowd out healthy ones, leaving you feeling weak and exhausted. Another reason is that cancer can affect your body's ability to produce healthy blood cells. Red blood cells carry oxygen to your tissues, and if your body isn't making enough of them, you can end up feeling tired and sluggish. This is called anemia, and it's a common side effect of many types of cancer, including colon cancer. If a tumor is causing internal bleeding, for example, it can lead to a loss of red blood cells and leave you feeling drained. But fatigue isn't just physical. It can be mental and emotional too. Dealing with cancer, even in its early stages, can take a toll on your mind and spirit. The stress, anxiety, and uncertainty can wear you down, adding to that feeling of exhaustion. And if the cancer is affecting your hormones or your immune system, that can also contribute to fatigue. Now, let's talk about the types of cancer that are often linked to persistent fatigue. Leukemia is a big one. This type of cancer affects your blood and bone marrow, and it can cause severe fatigue because your body isn't producing enough healthy blood cells. Colon cancer is another one to watch out for. If a tumor is causing internal bleeding, it can lead to anemia, which can make you feel tired and weak. Other cancers, like ovarian cancer or stomach cancer, can also cause fatigue, especially if they are affecting your body's ability to absorb nutrients or if they are causing other symptoms like pain or nausea. But here's the thing, persistent fatigue doesn't automatically mean you have cancer. There are plenty of other conditions that can cause this kind of exhaustion, like thyroid problems, depression, or chronic fatigue syndrome. The key is to pay attention to your body and take action if something seems off. If you're feeling tired all the time, even after getting plenty of rest, don't just chalk it up to aging or a busy schedule. Make an appointment with your doctor and get it checked out. Your doctor will likely ask you a lot of questions about your fatigue, like when it started, how severe it is, and whether you've noticed any other symptoms. They might also run some tests to rule out other possible causes and see if there's an underlying issue that needs to be addressed. The goal is to figure out what's going on and catch any potential problems early, when they are easier to treat. So if you or someone you love has been experiencing persistent fatigue, don't ignore it. It might be nothing, but it could also be a sign of something more serious. And when it comes to your health, it's always better to be safe than sorry. Early detection can make all the difference, so don't brush off the warning signs. Take care of yourself, listen to your body, and don't hesitate to reach out to your doctor if something doesn't feel right. Your health is worth it. Not all lumps are cancerous, but they should never be ignored. If you notice a new lump or swelling, whether it's in your neck, armpit, breast, or elsewhere, get it checked out. Early detection of lumps can be crucial for cancers like breast cancer or lymphoma. Let's take a closer look at this because lumps and swelling are some of the most common and often the most noticeable warning signs of cancer. But here's the thing, they're also some of the most misunderstood. Not every lump is a cause for panic, but every lump deserves attention. Why? Because when it comes to cancer, timing is everything. The sooner you catch it, the better your chances of successful treatment and recovery. So, what exactly are we talking about when we say lumps or swelling? Well, it could be anything from a small, pea-sized bump under your skin to a larger, more noticeable mass. It might feel hard or soft, painful or painless. It could appear suddenly or grow slowly over time. And it can show up just about anywhere on your body, your neck, your armpits, your groin, your breasts, or even your abdomen. The key is to pay attention to anything new or unusual. If you find a lump that wasn't there before, or if you notice swelling that doesn't go away, it's time to take action. Now let's talk about why lumps and swelling can be a sign of cancer. In many cases, a lump is caused by an abnormal growth of cells. Sometimes, those cells are harmless, like in the case of a cyst or a lipoma, a benign fatty tumor. But other times, those cells can be cancerous. For example, a lump in your breast could be a sign of breast cancer, while a swollen lymph node in your neck or armpit could be a sign of lymphoma or another type of cancer. Lymph nodes are part of your immune system, and they can swell when your body is fighting off an infection. But if the swelling doesn't go away, or if it's accompanied by other symptoms like fever, night sweats, or unexplained weight loss, it could be a sign of something more serious. Breast cancer is one of the most well-known cancers associated with lumps. If you feel a hard, irregularly shaped mass in your breast, it's important to get it checked out right away. But breast lumps aren't the only ones to watch out for. Lymphoma, a type of cancer that affects the lymphatic system, often causes swollen lymph nodes in the neck, armpits, or groin. These swollen nodes might feel rubbery and painless, and they can grow over time. Testicular cancer, on the other hand, often presents as a hard, painless lump in the testicle. And soft tissue sarcomas, which are rare but serious, can cause lumps or swelling in the muscles, fat, or other tissues of the body. But here's the important thing to remember: not all lumps are cancerous. In fact, most lumps are benign, meaning they're not cancerous. Cysts, lipomas, and swollen lymph nodes from infections are all common causes of lumps and swelling. The challenge is figuring out which lumps are harmless and which ones need further investigation, and that's where your doctor comes in. If you find a lump or notice swelling, don't panic, but don't ignore it either. Make an appointment with your doctor as soon as possible. They'll likely start by asking you some questions, like when you first noticed the lump, whether it's changed in size or shape, and whether you've experienced any other symptoms. They might also perform a physical exam to get a better sense of what's going on. Depending on what they find, they might recommend further tests, like an ultrasound, a biopsy, or blood work, to determine whether the lump is cancerous or not. The bottom line is this: when it comes to lumps and swelling, it's always better to be safe than sorry. Even if the lump turns out to be harmless, getting it checked out can give you peace of mind. And if it is something more serious, catching it early can make all the difference. Early detection is key when it comes to cancer, and that's especially true for cancers like breast cancer and lymphoma, where treatment is often most effective in the early stages. So if you or someone you love has noticed a new lump or swelling, don't wait, don't brush it off as nothing, and don't let fear keep you from seeking help. Your health is too important to ignore. Take action, get it checked out, and give yourself the best possible chance of staying healthy. Remember, not all lumps are cancerous, but every lump deserves attention. Your body is telling you something, listen to it. Pain that doesn't go away, especially if it's localized to one area, can be a warning sign. For example, persistent headaches could indicate brain cancer, while ongoing abdominal pain might be linked to ovarian or liver cancer. Don't just reach for painkillers, talk to your doctor. Let's unpack this because pain is one of those symptoms that's easy to dismiss or try to manage on your own. We all experience pain from time to time, whether it's a headache, a sore back, or a twinge in your side. But when pain sticks around and doesn't improve, it's your body's way of telling you that something's not right. And when it comes to cancer, persistent pain can be one of the earliest and most important warning signs. So what do we mean by persistent pain? We're talking about pain that lasts for weeks or even months, pain that doesn't go away with rest or over-the-counter medications, and pain that seems to have no obvious cause. It might be a dull ache, a sharp stabbing sensation, or a constant throbbing. It might come and go, or it might be there all the time. But the key is that it's not normal, and it's not something you should ignore. Now let's talk about why cancer can cause pain. In some cases, the pain is caused by the tumor itself. As the tumor grows, it can press on nerves, bones, or organs, causing discomfort or even severe pain. For example, a brain tumor can cause persistent headaches because it's putting pressure on the brain or the surrounding tissues. Similarly, a tumor in the abdomen, like ovarian cancer or liver cancer, can cause ongoing pain as it grows and affects nearby organs. In other cases, the pain might be caused by the cancer spreading to other parts of the body. This is called metastatic cancer, and it can cause pain in areas far from the original tumor. For example, if cancer spreads to the bones, it can cause bone pain that feels deep and aching. If it spreads to the nerves, it can cause shooting or burning pain. And if it spreads to the liver, it can cause pain in the upper right side of the abdomen. But here's the thing, not all persistent pain means cancer. There are plenty of other conditions that can cause chronic pain, like arthritis, migraines, or digestive issues. The challenge is figuring out what's causing the pain and whether it's something that needs immediate attention, and that's where your doctor comes in. If you're experiencing persistent pain, especially if it's localized to one area, don't just reach for painkillers and hope it goes away. Make an appointment with your doctor and get it checked out. They'll likely start by asking you some questions, like when the pain started, how severe it is, and whether you've noticed any other symptoms. They might also perform a physical exam to get a better sense of what's going on. Depending on what they find, they might recommend further tests, like imaging scans or blood work, to determine the cause of the pain. Let's break it down by some specific types of pain and the cancers they might be linked to. Persistent headaches, for example, can be a sign of brain cancer, especially if they're accompanied by other symptoms like nausea, vomiting, or changes in vision. Ongoing abdominal pain, on the other hand, can be a sign of ovarian cancer, liver cancer, or pancreatic cancer, especially if it's accompanied by bloating, changes in bowel habits, or unexplained weight loss. Back pain can be a sign of several types of cancer, including pancreatic cancer, colon cancer, or even multiple myeloma, a type of blood cancer that affects the bones. But here's the important thing to remember. Pain is your body's way of sending you a message. It's not something to ignore or try to tough out. If you're experiencing persistent pain, it's worth taking seriously. Even if it turns out to be nothing serious, getting it checked out can give you peace of mind. And if it is something more serious, catching it early can make all the difference. So if you or someone you love has been dealing with persistent pain, don't wait. Don't brush it off as just part of getting older, and don't let fear keep you from seeking help. Your health is too important to ignore. Take action, talk to your doctor, and give yourself the best possible chance of staying healthy. Remember, pain is your body's way of telling you something. Listen to it. A cough that lasts more than a few weeks or a hoarse voice that doesn't improve could be a sign of lung, throat, or thyroid cancer. If you're a smoker or have a history of smoking, this is especially important to monitor. Let's dive deeper into this because coughing and hoarseness are symptoms that many of us tend to brush off, especially during cold and flu season or allergy season. But when a cough or a raspy voice sticks around for weeks or even months, it's not something to ignore. It could be your body's way of signaling that something's not right, and when it comes to cancer, early detection is absolutely critical. First, let's talk about chronic coughs, We've all had a cough at some point. Maybe it was a lingering side effect of a cold, or maybe it was triggered by seasonal allergies. But a chronic cough is different. It's a cough that lasts for more than a few weeks, one that doesn't seem to go away no matter how much cough syrup you take or how many home remedies you try. It might be dry and hacking, or it might produce mucus. It might come and go, or it might be constant. But the key is that it's persistent and it's not improving. So why could a chronic cough be a sign of cancer? In some cases, it's because the cancer is affecting your respiratory system. For example, lung cancer can irritate the airways, causing a persistent cough. This is especially true if the tumor is located near the bronchi, the tubes that carry air to and from your lungs. The cough might start off mild, but over time, it can become more severe and may even be accompanied by other symptoms like shortness of breath, chest pain, or coughing up blood. And if you're a smoker or have a history of smoking, your risk of lung cancer is higher, which makes it even more important to pay attention to a chronic cough. But lung cancer isn't the only type of cancer that can cause a chronic cough. Throat cancer, which includes cancers of the larynx, voice box, and pharynx, throat, can also lead to a persistent cough. This is because the tumor can irritate the throat or block the airway, causing you to cough. And thyroid cancer, though less common, can sometimes cause a cough if the tumor is pressing on the windpipe or nearby structures. Now let's talk about hoarseness. A hoarse voice is one that sounds raspy, strained, or weaker than usual. It's the kind of voice you might get after cheering too loudly at a concert or yelling at a sports game. But if your voice stays hoarse for more than a few weeks, and especially if you haven't been overusing it, that's a red flag. Hoarseness can be a sign of throat cancer, particularly cancer of the larynx. The larynx contains your vocal cords, and if a tumor is growing there, it can affect your voice. You might notice that your voice sounds different or that it's harder to speak loudly or clearly. And like with a chronic cough, if you're a smoker or have a history of smoking, your risk of throat cancer is higher, so hoarseness is something to take seriously. But here's the thing, not all chronic coughs or hoarseness mean cancer. There are plenty of other conditions that can cause these symptoms, like acid reflux, asthma, or even certain medications. The challenge is figuring out what's causing the problem and whether it's something that needs immediate attention. And that's where your doctor comes in. If you've had a cough that won't go away or a hoarse voice that doesn't improve, don't just chalk it up to a cold or allergies. Make an appointment with your doctor and get it checked out. They'll likely start by asking you some questions, like when the cough or hoarseness started, whether it's accompanied by other symptoms, and whether you have a history of smoking or exposure to other risk factors like secondhand smoke or environmental toxins. They might also perform a physical exam, listen to your lungs, or look at your throat with a special scope. Depending on what they find, they might recommend further tests like a chest X-ray, a CT scan, or a biopsy to determine the cause of your symptoms. The bottom line is this: when it comes to chronic coughs and hoarseness, it's always better to be safe than sorry. Even if the symptoms turn out to be nothing serious, getting them checked out can give you peace of mind. And if they are a sign of something more serious, catching it early can make all the difference. Early detection is key when it comes to cancer, and that's especially true for cancers like lung cancer and throat cancer, where treatment is often most effective in the early stages. So if you or someone you love has been dealing with a chronic cough or hoarseness, don't wait. Don't brush it off as just a lingering cold or a side effect of aging. Take action, talk to your doctor, and give yourself the best possible chance of staying healthy. Remember, your body is telling you something, listen to it. Whether it's a cough that won't quit or a voice that's lost its strength, these symptoms are worth taking seriously. Your health is too important to ignore. Blood in your stool, persistent diarrhea or constipation, or changes in bladder function could be signs of colorectal, bladder, or prostate cancer. Don't dismiss these changes. Early detection can save lives. Let's take a closer look at this because changes in bowel or bladder habits are some of the most important warning signs of cancer, yet they're also some of the most overlooked. Why? Because talking about these things can feel uncomfortable or embarrassing. But here's the thing, your body is giving you important information, and ignoring it could mean missing a critical opportunity to catch cancer early. So, let's break it down and talk about what these changes might mean and why they're so important to pay attention to. First, let's talk about changes in bowel habits. Your bowel habits are as unique as you are. What's normal for one person might not be normal for another. But if you notice a persistent change in your bowel movements, that's something to take seriously. This could include things like blood in your stool, persistent diarrhea or constipation, or a change in the size, shape, or consistency of your stool. These changes can be a sign of colorectal cancer, which is one of the most common types of cancer, and also one of the most treatable when caught early. Blood in your stool is one of the most obvious red flags. It might show up as bright red blood on the toilet paper or in the toilet bowl, or it might appear as dark, tarry stools. Either way, it's not something to ignore. Blood in your stool can be caused by a number of things, including hemorrhoids or anal fissures, but it can also be a sign of colorectal cancer. If a tumor is growing in your colon or rectum, it can cause bleeding, which shows up in your stool. And if the bleeding is happening higher up in your digestive tract, it can make your stool look black and tarry. Either way, it's worth getting checked out. Persistent diarrhea or constipation is another warning sign. If you've been dealing with diarrhea that won't go away, or if you're suddenly constipated for no obvious reason, that's something to pay attention to. Colorectal cancer can affect how your digestive system works, leading to changes in your bowel habits. For example, a tumor might partially block your colon, causing constipation, or it might irritate your intestines, causing diarrhea. And if you notice that your stool is narrower than usual, sometimes described as pencil thin, that could be a sign that something is obstructing your colon. Now, let's talk about changes in bladder habits. Just like with bowel habits, changes in how you urinate can be a sign that something's not right. This could include things like blood in your urine, difficulty urinating, or a sudden need to urinate more often. These changes can be a sign of bladder cancer or prostate cancer, especially in men. Blood in your urine, also known as hematuria, is one of the most common symptoms of bladder cancer. It might show up as pink, red, or cola-colored urine, or you might not even notice it until it's detected in a urine test. Either way, it's not something to ignore. Blood in your urine can also be caused by other conditions, like a urinary tract infection or kidney stones, but it's always worth getting checked out to rule out something more serious. Difficulty urinating is another red flag, especially for men. If you're having trouble starting or stopping your urine stream, or if your stream is weak or interrupted, that could be a sign of prostate cancer. The prostate gland surrounds the urethra, the tube that carries urine out of the body, and if a tumor is growing in the prostate, it can put pressure on the urethra, making it harder to urinate. Other symptoms of prostate cancer can include a frequent need to urinate, especially at night, or pain or burning during urination. But here's the important thing to remember. Not all changes in bowel or bladder habits mean cancer. There are plenty of other conditions that can cause these symptoms, like irritable bowel syndrome, IBS, urinary tract infections, or an enlarged prostate. The challenge is figuring out what's causing the problem and whether it's something that needs immediate attention, and that's where your doctor comes in. If you've noticed changes in your bowel or bladder habits, don't just brush them off or hope they'll go away on their own. Make an appointment with your doctor and get it checked out. They'll likely start by asking you some questions, like when the changes started, how severe they are, and whether you've noticed any other symptoms. They might also perform a physical exam or recommend further tests, like a colonoscopy, a urine test, or a prostate exam to determine the cause of your symptoms. The bottom line is this: when it comes to changes in bowel or bladder habits, it's always better to be safe than sorry. Even if the symptoms turn out to be nothing serious, getting them checked out can give you peace of mind. And if they are a sign of something more serious, catching it early can make all the difference. Early detection is key when it comes to cancer, and that's especially true for cancers like colorectal cancer, bladder cancer, and prostate cancer. where treatment is often most effective in the early stages. So, if you or someone you love has been dealing with changes in bowel or bladder habits, don't wait. Don't brush it off as just a minor inconvenience or a normal part of aging. Take action, talk to your doctor, and give yourself the best possible chance of staying healthy. Remember, your body is telling you something, listen to it. Whether it's blood in your stool, persistent diarrhea, or difficulty urinating, these symptoms are worth taking seriously. If you're having trouble swallowing or feel like food is getting stuck, it could be a sign of esophageal or throat cancer. This symptom should never be ignored, especially if it persists. Let's dive deeper into this because difficulty swallowing, also known as dysphagia, is one of those symptoms that can start off subtle but quickly become a major concern. It's not just an inconvenience, it's your body's way of telling you that something might be wrong, and when it comes to cancer, early detection can make all the difference. So, what does difficulty swallowing feel like? It might start as a slight discomfort when you eat or drink, like food or liquids taking a little longer to go down than usual. Over time, it can progress to a feeling that food is getting stuck in your throat or chest, or even pain when you swallow. You might notice that you're avoiding certain foods, especially dry or dense ones, because they are harder to get down. Or you might find yourself coughing or choking when you eat, as if your body is struggling to move food through your esophagus. These are all signs that something's not right, and they are worth paying attention to. Now, let's talk about why difficulty swallowing can be a sign of cancer. The esophagus is the tube that carries food and liquids from your mouth to your stomach, and if a tumor is growing in the esophagus or throat, it can block or narrow the passage, making it harder for food to get through. This is especially true for esophageal cancer, which often starts in the cells lining the esophagus and can grow to obstruct the tube. Throat cancer, which includes cancers of the pharynx, throat, and larynx, voice box, can also cause difficulty swallowing if the tumor is pressing on the esophagus or affecting the muscles and nerves involved in swallowing. But here's the thing, difficulty swallowing doesn't automatically mean cancer. There are plenty of other conditions that can cause dysphagia, like acid reflux, which can irritate and narrow the esophagus over time, or a condition called achalasia, where the muscles of the esophagus don't work properly. Even something as simple as a sore throat or an infection can make swallowing uncomfortable for a little while. The challenge is figuring out what's causing the problem and whether it's something that needs immediate attention, and that's where your doctor comes in. If you're experiencing difficulty swallowing, especially if it's persistent or getting worse, don't just brush it off as a minor annoyance. Make an appointment with your doctor and get it checked out. They'll likely start by asking you some questions, like when the problem started, whether it's affecting solids, liquids, or both, and whether you've noticed any other symptoms, like weight loss, hoarseness, or pain. They might also perform a physical exam or recommend further tests, like an endoscopy, where a thin, flexible tube with a camera is used to look at your esophagus and throat, or a barium swallow, where you drink a special liquid that shows up on X-rays to help identify any blockages or abnormalities. The bottom line is this: when it comes to difficulty swallowing, it's always better to be safe than sorry. Even if the symptom turns out to be nothing serious, getting it checked out can give you peace of mind. And if it is a sign of something more serious, catching it early can make all the difference. Early detection is key when it comes to cancer, and that's especially true for cancers like esophageal cancer and throat cancer, where treatment is often most effective in the early stages. So, if you or someone you love has been dealing with difficulty swallowing, don't wait. Don't brush it off as just a minor inconvenience or a normal part of aging. Take action, talk to your doctor, and give yourself the best possible chance of staying healthy. Remember, your body is telling you something, listen to it. Whether it's food getting stuck, pain when you swallow, or a feeling that something's just not right, these symptoms are worth taking seriously. New moles, changes in existing moles, or unusual skin patches can be early signs of skin cancer. Keep an eye on your skin and report any changes to your doctor immediately. Let's dive deeper into this because your skin is your body's largest organ, and it's also one of the most visible indicators of your overall health. Changes in your skin, whether it's a new mole, a spot that looks different, or a patch that just doesn't seem right, can be early warning signs of skin cancer. And while skin cancer is one of the most common types of cancer, it's also one of the most treatable when caught early. That's why it's so important to pay attention to your skin and take action if you notice anything unusual. So, what exactly should you be looking for? Let's start with moles. Most people have moles, those small, dark spots on the skin that are usually harmless. But if you notice a new mole, or if an existing mole starts to change in size, shape, color, or texture, that's something to take seriously. The same goes for any spot on your skin that looks different from the others. This could be a sign of melanoma, the most serious type of skin cancer, which often starts in moles or other pigmented areas of the skin. But it's not just moles you need to watch out for. Skin cancer can also show up as unusual patches or growths on the skin. For example, basal cell carcinoma, the most common type of skin cancer, often looks like a pearly or waxy bump or a flat, flesh-colored or brown scar-like lesion. Squamous cell carcinoma, another common type of skin cancer, can appear as a firm, red nodule or a flat lesion with a scaly, crusted surface. And then there's actinic keratosis, a precancerous condition that shows up as rough, scaly patches on the skin, usually in areas that have been exposed to the sun. These patches can sometimes develop into squamous cell carcinoma if left untreated. Now let's talk about the uplift of melanoma, a helpful guide for spotting potential warning signs. A stands for asymmetry. If one half of a mole doesn't match the other half, that's a red flag. B is for border. If the edges of a mole are irregular, ragged, or blurred, that's something to pay attention to. C is for color. If a mole has multiple colors or an uneven distribution of color, that's a warning sign. D is for diameter. If a mole is larger than about 6 millimeters, roughly the size of a pencil eraser, it's worth getting checked out. And E is for evolving. If a mole is changing in size, shape, color, or elevation, or if it starts to itch, bleed, or crust over, that's a sign that something's not right. But here's the thing, not all skin changes mean cancer. There are plenty of other conditions that can cause new moles, spots, or patches on the skin, like harmless skin growths, infections, or even just the natural aging process. The challenge is figuring out what's causing the change and whether it's something that needs immediate attention, and that's where your doctor comes in. If you notice any changes in your skin, whether it's a new mole, a spot that looks different, or a patch that just doesn't seem right, don't wait. Make an appointment with your doctor or a dermatologist and get it checked out. They'll likely start by examining the area and asking you some questions, like when you first noticed the change and whether it's been getting worse. Depending on what they find, they might recommend a biopsy, where a small sample of the skin is taken and examined under a microscope to determine whether it's cancerous. The bottom line is this: when it comes to skin changes, it's always better to be safe than sorry. Even if the change turns out to be nothing serious, getting it checked out can give you peace of mind. And if it is a sign of something more serious, catching it early can make all the difference. Early detection is key when it comes to skin cancer, and that's especially true for melanoma, which can spread quickly if not treated. So if you or someone you love has noticed any changes in their skin, don't ignore it. Don't brush it off as just a harmless spot or a normal part of aging. Take action, talk to your doctor, and give yourself the best possible chance of staying healthy. Remember, your skin is your body's first line of defense. Listen to it. Whether it's a new mole, a changing spot, or an unusual patch, these changes are worth taking seriously. Your health is too important to ignore. Remember, these symptoms don't always mean cancer, but they are worth checking out. Early detection is your best defense. If you or a loved one notice any of these signs, don't wait, schedule an appointment with your healthcare provider. Your health is worth it. Let's take a moment to really drive this home, because when it comes to your health, being proactive can make all the difference. It's easy to brush off symptoms, especially if they seem minor or if life gets busy. But here's the thing, your body is constantly communicating with you, and those little signs, whether it's a persistent cough, a new mole, or unexplained weight loss, are its way of telling you that something might be wrong. Ignoring those signals could mean missing a critical opportunity to catch a problem early, when it's most treatable. Think about it this way: cancer, like many other serious illnesses, often starts quietly. In the early stages, the symptoms might be subtle or easy to dismiss. A little fatigue here, a small lump there, nothing that seems like a big deal at first. But over time, those small signs can add up, and by the time the symptoms become impossible to ignore, the cancer might have already progressed. That's why early detection is so important. When cancer is caught early, the treatment options are often more effective, less invasive, and more likely to lead to a full recovery. But the key is to act quickly, and that means paying attention to your body and taking action when something doesn't feel right. Now let's talk about what you can do. First and foremost, be aware of your body. Know what's normal for you and what's not. If you notice any changes, whether it's a new symptom or something that just feels off, don't ignore it. Write it down, keep track of it, and bring it up with your doctor. Even if it turns out to be nothing, it's always better to be safe than sorry. And if you're someone who tends to put off going to the doctor, try to shift your mindset. Think of it as an investment in your health and your future. A single appointment could give you peace of mind, or it could save your life. It's also important to stay on top of your regular checkups and screenings. Depending on your age, family history, and other risk factors, your doctor might recommend certain tests to screen for cancer, like mammograms, colonoscopies, or skin exams. These screenings are designed to catch cancer early, often before you even notice any symptoms. So don't skip them. Make them a priority, and if you're not sure what screenings you need, talk to your doctor. They can help you create a plan that's tailored to your individual health needs. And let's not forget about lifestyle choices. While there's no surefire way to prevent cancer, there are steps you can take to lower your risk. Eating a healthy diet, staying active, avoiding tobacco, limiting alcohol, and protecting your skin from the sun are all things you can do to support your overall health and reduce your risk of cancer. It's not about being perfect. It's about making small, sustainable changes that add up over time. Finally, if you're worried about a symptom, or if you've been putting off seeing a doctor, don't let fear hold you back. It's normal to feel anxious or scared, but remember that knowledge is power. Getting checked out can give you answers, and those answers can help you take control of your health. Whether it's good news or a diagnosis that requires treatment, knowing what you're dealing with is always better than not knowing. So if you or a loved one notice any of the signs we've talked about, whether it's unexplained weight loss, persistent fatigue, a new lump, or anything else that doesn't seem right, don't wait. Pick up the phone, schedule an appointment, and take that first step. Your health is worth it. Early detection is your best defense, and you owe it to yourself to take care of the body that carries you through life every single day. Remember, you're not alone. Your healthcare provider is there to help you, and taking action now could make all the difference in the world. Your health is your greatest asset. Protect it. Have you or someone you know experienced these symptoms? Share your story in the comments below. Your experiences could help others feel less alone and encourage them to take action for their health. And don't forget to like, subscribe, and hit the notification bell for more health tips and advice. Staying informed is one of the best ways to take control of your health, and we're here to help you every step of the way. Stay healthy, stay informed, and take care of each other. But wait, did you know that certain breakfast choices could potentially harm your health, especially as you get older? It's true, what you eat in the morning can have a huge impact on your overall well-being, and some common breakfast foods might be doing more harm than good. Want to know which ones to avoid and why? Click here to watch our next video, where we break down the breakfast foods that could be putting your health at risk. Don't miss it. Your morning routine might need a makeover.